We're going to talk about the abortion pill a little bit first. The abortion pill is responsible for 39% of all the abortions now in the United States. But first, we need to make a distinction between the morning after pill and the abortion pill, because a lot of people just don't understand. They're both evil, but let's define and understand what we're talking about. The morning after pill is indicated for 72 hours after somebody has had conception when they might have gotten pregnant. And they take the morning after pill, and it's going to force them to have a menstrual cycle. And if they happen to get pregnant, it would cause them to pass that pregnancy. That's opposed to the abortion pill. The abortion pill, which is also known as Mifeprex, also known as RU46, its mechanism of action is very different. We need to first understand the basic pharmacology of what supports a pregnancy and how an abortion pill actually works to disrupt that pregnancy. I mean, don't forget, these pills, which are now available mail order, are now available without even seeing an obstetrician and getting an ultrasound, which can be available via telemedicine depending on where you live and what state. And that can be mailed to your house, and your daughter can receive this very generalized package, and you wouldn't even know, number one, that she's pregnant, and number two, that she's having an abortion upstairs. So let's talk basic pharmacology. If a patient is supposed to just take 2 units of insulin, but they make a mistake and they take 22 units of insulin, and they come into our emergency room and their sugar level has dropped too much because instead of 2 units of insulin, they took 22. Well, if their glucose level has dropped down and they're symptomatic and they're in trouble, well, if their glucose level has dropped down, well, what do? We give them glucose. We give them an AMPA D50 IV, and we raise their glucose level. And the brain goes, thank you, I really needed that. When it comes to replacing different things in the body, if it's low, then we elevate it up to a normal level. When it comes to basic obstetrics, when it comes to the pharmacology of pregnancy, when a woman becomes pregnant, the orchestra, the conductor of the orchestra of pregnancy is a hormone called progesterone. This is like the coach of the football team of pregnancy, and it's called progesterone. Break that word down. Whenever we have big words, break them down into smaller words. Progesterone, progesterone, progestation. It is the hormone that supports the pregnancy and supports the pregnancy. It's the hormone that signals to the rest of the body and go, hey, time out, y'all. We are pregnant. We have a new full-time job. We are now going to support this pregnancy. We're going to send more resources, more blood down to the uterus. We're going to allow the uterus to relax because it's going to go from being the size of a lemon to the size of a watermelon. We're going to make sure the cervix stays closed, and we're going to aid in that junction between the woman's body and the placenta of the baby so we can support and grow this pregnancy. So the hormone that says we're going to support this pregnancy and we're not going to have a menstrual cycle is called progesterone. In routine obstetrics, when somebody has had a miscarriage, maybe they've had a second miscarriage, or maybe they have other conditions going on in their pregnancy, we will routinely do a blood test and see what the level of progesterone is. If we have somebody who's had a couple of miscarriages, the standard of care for treating somebody who's had recurrent miscarriages, and we check their progesterone level, and we say, this level is really low. Just like if somebody's glucose level is low, we give them sugar to raise their glucose level. In normal everyday obstetrics, if their progesterone level is low, we give them progesterone to support it. We use progesterone to prevent preterm labor. We use progesterone when we have twins and triplets. I have a set of triplets that got to over 32 weeks, and we gave her progesterone through the whole pregnancy to be progestational. So progesterone is not this dusty medicine over in the corner of a pharmacy that never gets used for anything else. We use it all the time in our routine obstetrics. It is just basic pharmacology. Progesterone level is low, well, we'll raise the progesterone level. We do a lot of things where we have antidotes in medicine. People make bad decisions. One of the antidotes that we use the most is when it comes to narcotics. I mean, we've lost tens of thousands of people because of drug overdoses, primarily due to narcotics. It is in the cities, it is in the rural areas, it is in the suburbs. I mean, it is all over. Well, when we have a patient that comes in who's made a bad decision and overdosed on a narcotic, they have too much of this narcotic and they are not breathing, they are not alert. So what do? We give them the antidote. We give them Narcan. Narcan is an amazing medication. It's like Sleeping Beauty. You have somebody who you can't arouse them, you can't get them to wake up, you can't get them to respond. You give them an injection of Narcan, you give them a nasal spray of Narcan, you give them Narcan in any way, and they will just wake up almost finishing the sentence that they were using before they went out because of too much narcotic. In fact, our police now carry Narcan because they come across. They even have Narcan that they can use for their drug sniffing dogs, because if a drug dog sniffs too much fentanyl, the drug will affect the dog. We have Narcan that we can actually give to dogs. So we have things that we use as antidotes routinely. If somebody makes a bad decision and they take too much narcotic, we can correct it. Somebody makes a decision, by error, they took too much insulin and their glucose levels go low, we can replace their glucose. So let's talk about the mechanism of action of the abortion pill. 39% of all abortions, over 300 abortions, and not 72 hours, but these are abortions which are indicated for over 70 days. Baby is 10 weeks along. Most of the ultrasounds that you'll see by a friend or people are showing your picture, their first trimester. They might be 6, 7, 8 weeks, and you can see the baby, you can see the fluid, you can hear the heartbeat, see the motion, see the baby moving around. So when we're talking about the abortion pill, it aborts and kills a baby up to 10 weeks gestation, and there are already studies that are being done looking at, can we use this beyond 10 weeks gestation? How does it work? Well, we talked about the conductor of pregnancy, the coach of pregnancy is this hormone called progesterone, progestation. The first set of pills that is used is what's called RU46, the abortion pill. And it's very effective in blocking the signal of progesterone. So a woman becomes pregnant and she goes, woohoo, hallelujah, we're pregnant, we have a new full-time job, we're going to support this pregnancy. Say that was something that was being announced with a megaphone, attention body, we are now pregnant. When they take the RU46 blocks that signal. So the body has gone from, wow, we're pregnant, to, I thought we were pregnant. Maybe we're not pregnant. Well, if we're not pregnant, then we don't need to be sending blood to support the pregnancy. We don't have to develop this junction and this union between the placenta and the woman's body. We don't need to relax the uterus. And everything that you don't want to happen in the beginning of the pregnancy, the abortion pill starts to make that happen, because the abortion pill blocks that hormone called progesterone. The next thing that happens when somebody's taking the abortion pill is they are told 24 hours later to take a medication called Cytotec. Cytotec is what's known as a prostaglandin. Cytotec will cause the uterus to contract. In very low doses, Cytotec can be used to induce a term labor. When I'm inducing, say it's an 8-pound baby and she's 40 weeks pregnant, we're going to induce her. I use a tiny little tablet of 25 micrograms of Cytotec to put her into labor and initiate the labor process. When somebody's taking the abortion pill and then 24 hours later she has to take this Cytotec, this Mifeprex, in order to have the contraction start, she doesn't take 25 micrograms. She takes a total of 800 micrograms of this medication to cause these vigorous contractions. So the first pill, the abortion pill, the first pill decreases the blood supply, the support for the pregnancy. It makes the uterus start to break down this lining, this connection between the baby and the mom, and it makes the uterus more susceptible, more prone to the effects of a medication like a prostaglandin, which causes contractions. So all of a sudden the process is started by the abortion pill, and then 24 hours later they followed up with this medication which causes the contractions. And these are violent contractions. So what does a mom expect? I think moms kind of anticipate that I'm pregnant and I'm going to take the abortion pill and it's going to kind of dissolve and just sort of make it go away. Maybe I'll have some spotting, bleeding. There is fluid that needs to be passed. There's a placenta that needs to be passed. There is everything you can see moving on the inside. All that needs to be passed. So what's typical? Oh, a mom is going to be home. A lot of these moms are not only home, they're alone. They might not have any family support. There might not be anybody at home. And they're going to have cramping, they're going to have bleeding, and they're going to have pain. And they're going to pass this pregnancy, and this baby's going to die there on the inside, and they're going to deliver this baby, even though small, deliver this baby at home. What's also, this is not about health care. Why is it not about health care? because there was a federal judge up in Maryland who said it was an undue burden during COVID for women to have to go to a doctor's office in order to be examined and to have an ultrasound. Why is this dangerous when it comes to the abortion pill? The number one cause of death in pregnant women in the first trimester is still a ruptured ectopic or tubal pregnancy. Women become pregnant. It happens about 1 in 100 times where it's a tubal pregnancy, where instead of the pregnancy taking place in landing in the uterus, it lands in the tube. Well, when a woman takes the abortion pill, she's going to be told you're going to have bleeding, you're going to have cramping, and you're going to have pain. As opposed to a tubal pregnancy, where what will she experience? Bleeding, cramping, and pain. Tell me how a woman is supposed to know the difference between the abortion pill causing bleeding, cramping, and pain and the woman having a rupturing ectopic tubal pregnancy where she also is going to experience bleeding and cramping and pain. It's not good medicine. So just the fact that they are allowing the abortion pill to be prescribed and to be delivered without having an ultrasound to see where is the pregnancy. A urine pregnancy test only says there's a pregnancy. It doesn't say, and the pregnancy is there. It just says there's a pregnancy. But 1 in 100 times, that pregnancy can be up in the tube. And the abortion pill is not a treatment for treating a tubal pregnancy. So can the abortion pill effects be reversed? Well, we already talked about how if somebody's glucose level is low, we supplement them with glucose. We bring their sugar levels up. When a patient comes in and her condition of why she's having miscarriage is that her progesterone level is low, it's now standard of care. We just supplement with more progesterone to bring it up into a normal range. Well, if a patient has taken the abortion pill and her progesterone level has been brought down because of the abortion pill, well, can you reverse the effect of the abortion pill by supplementing with the same progesterone that you would use in other conditions? Absolutely. And we have seen lots of success across the United States. And here's a real key. There is no evidence that the abortion pill itself is teratogenic. We don't have any evidence that the abortion pill causes any kind of birth defects. It's kind of an all or none. It's either going to kill the baby or it's not going to have any effect on the baby. And we haven't seen that it can cause birth defects. Also, the reversal medication, the progesterone, if the progesterone is used by a physician, we use this all the time in normal obstetrics. There's a medication called prometrium. Prometrium is made from an extract from yams and from soybeans. It is bioidentical to the progesterone that a woman's body makes. It's not that it's similar or that it's close. Remember those chemical structures that we would study in chem? It's the exact same thing. So it's the same structure, it's recognized. So we use that in obstetrics. So when it comes to when a physician is going to try to reverse the effect of the abortion pill, if they can, become involved, in enough time. When it comes to reversing the effect of the abortion pill, we're either going to be successful or we're not going to be successful. It's not a question of, are you going to be successful and then the baby has one arm or the baby has a heart defect? We don't see that any evidence of that. So it's going to be a red light or a green light. We either were successful or we're not going to be successful, but we don't see that there's some sort of a gray area where baby has a heartbeat, but baby has a lot of issues. We just don't see that.